These are the top 5 issues that I tend to see in my therapy practice. First is people wanting support and help with relationship issues within their family. Family relationships can often have a lot of conflict. There can be history of abuse, difficult personalities having to get together, and all sorts of things that create a lot of conflict and difficulty for people. The next one is significant relationships in terms of whether someone's struggling with a recent breakup or divorce, or whether they're not sure if they want to stay in their long-term relationship anymore, or people just seeking an ideal partner. As they've healed, they may be looking for different patterns than what they had in the past. The next one that I see a lot of is caregiver burnout. So whether it's people taking care of elderly relatives, family members, things like that, caretaking for their own family, for children, for spouses, children with special needs, all of those things can lead to caregiver burnout, especially for people who try to do too much, have a hard time saying no, and tend to take on lots of tasks at work, at home, and everywhere in between, and they just get burned out. The next one that I see a lot of is grief. A lot of people struggling with different losses, losses of parents, children, significant others. When someone loses a critical family member, it can be a very difficult time, and therapy can really help them with that process. And then the last one I see a lot of is loneliness and social isolation. And that's one that I think in our modern times, a lot of people don't realize how disconnected we've become. And there are quite a few people that struggle with social isolation and feelings of loneliness.